Everferon is a pharmaceutical formulation of recombinant interferon alpha 2b and recombinant interferon gamma coleophylaxis in a side vial. The combination was defined by in vitro antiproliferative assays that identify the synergistic proportion of the mix. Everferon was registered for basal cell carcinoma in 2016. Now we are preparing the dossier for a new indication in malignant glioma and for renal cell carcinoma, stage 3 and 4 after nephrectomy. Other clinical investigations are in course in cutaneous squamous cell carcinoma and squamous cell carcinoma of the head and neck. In the context of COVID-19 pandemic, everferon was used in patients at diagnosis of SARS-CoV-2 virus, with excellent results in the viral clearance. This led to the approval by the Cuban regulatory authorities of everferon from patients with COVID-19. The approved everferon indications are for intradermal and perilesional treatment of basal cell carcinoma as an alternative or adjuvant to other procedures, surgical or not, for lesion of any size, localization, or subtype, mainly for high-risk zone or locally advanced. In 2022, was also registered using subcutaneously for patients are high risk positive for SARS-CoV-2. Biological function of everferon consists of tumor suppressors, induction of apoptosis, has also anti-angiogenic properties, can control the cell cycles, activate the NK cells, sensitive base to chemotherapy, and inhibit a head-to-head signal pathway that is involved in the development of several kinds of tumors, including basal cell carcinoma. Everferon in non-melanoma skin cancer. These are the clinical trials with Everpac or everferon in basal cell carcinoma. The first clinical trial was conducted with the formulation Everpac that consisted in the mix of Everon alpha and Everon gamma formulation already existing at CIGV just before the injection. These are formulations registered for viral disease, cancer, and infectious disease at CIGV in Cuba. The proof of concept of clinical antiproliferative effect of the combination of interferon alpha and gamma was demonstrated in a phase 2 trial comparing interferon alpha, interferon gamma, and their combination. The study demonstrated that the Everpac produced more rapid anti-tumor effect and more number of complete responses. The other study was the open uncontrolled trial in patients with advanced non-melanoma skin cancer. This included basal cell carcinoma and cutaneous squamous cell carcinoma. These two trials permitted the registration of Everpac in 2018. Adverse events with everferon are less intense than with separated interferons. Everferon is curative and avoids risky surgery and scar formation with a high impact on the aesthetic and quality of life of patients. You can see in this picture that even after 2 years of follow-up, the complete response has maintained with excellent aesthetic effect. What can prevent treatment with everferon? The most effective procedure to eliminate this kind of tumor is the Mohs surgery. This is highly effective, but can produce some mutilation in the tumor localization. In the case of conventional surgery, some aesthetic compromise can occur after surgery. In the case of everferon, it is possible to obtain complete response without affect the organ or the zone of tumor localization. This is advanced basal cell carcinoma that was treated with everferon combined with chemotherapy. You can see a resolution of this big tumor after this treatment, also with excellent aesthetic effect. Another interesting property of interferon is that exerts anti-tumor effect in non-treated lesion near or distant from the treated tumor, and this we are thinking that this is effect mediated by the immune system. For the interferon registration, we compare the Everpac formulation and the everferon in bioequivalence study to transpolate the Everpac result from clinical pivotal trials to everferon. These were a physicochemical comparison, PK and PD, in non-human primates and also in healthy volunteers. The formulations were demonstrated to be similar, and the results from the trial went to everferon. A clinical phase 1 trial in periocular basal cell carcinoma with everferon was conducted and included in the dossier for the everferon registration. A national program for the use of everferon was organized in Cuba. In this program are more than 700 specialists. 600 are highly trained to use the everferon, and there are more than 70 associated clinical investigations with the use of everferon in the practical medicine. From this, we have obtained results and published more than 60 papers. In the real data study was evidenced that everferon produced complete response between 46 and 68% in patients with 1 to 4 lesions. In the case of more than 5 lesions, the results are not so good. Everferon avoided indicated procedures with high risk of minor aesthetic sequelae, as mutilation. You can see that we can avoid approximately 26% of indicated mutilation in several regions, nose, ear, and eyelid. Those are the regions of high risk for this kind of tumor. Another important result was that we evidenced that even Everpac or everferon exert strong anti-tumor effect in more aggressive basal cell tumors. We have conducted also a clinical trial, phase 2, in cutaneous squamous cell carcinoma with the treatment of Everpac. In this case, we have obtained also 68% of complete response that is similar to what we have obtained in the case of basal cell carcinoma. Cutaneous squamous cell carcinoma is more aggressive and can metastasize and has a higher rate of death. This is a very aggressive tumor compared with the basal cell carcinoma. These are the pictures. From the clinical trial with this squamous cell carcinoma. These are the pictures before and after the treatment with Everpac. You can see the resolutions and the aesthetic results after treatment. This is another case, very complicated case, because this is a cutaneous squamous cell carcinoma recurring after surgery in the internal can. This the surgery may be mutilate the lagrimal, and when we use Everferon, we can obtain a complete response with a better aesthetic effect. This is also an interesting result. This very big squamous cell carcinoma that was treated with Everferon combined with cisplatin. You can see the resolution of the tumor. This is a huge squamous cell carcinoma, advanced, that treated only with Everferon was reduced and permitted the use of other procedures to eliminate completely the tumor. When we have done a follow-up of patients treated with Everferon or Everpac in patients with primary basal cell carcinoma or primary cutaneous squamous cell carcinoma, we observed that patients with complete response maintained the response after 5 years. There were no recurrence. Another observation during these trials was that the Everferon reduces the rate of new lesion by 8 times. Normally, basal cell carcinoma patients have 40% of possibility to have a new lesion. If you use Everferon, you can reduce the rate. When we look to the market and see some of the drugs in the market and the results in advanced basal cell carcinoma, you can see that the treatment with Everferon has more superior clinical effect on this recurrent tumor that do not respond to previous procedures. In the case of adverse event, was observed that, for example, bismuth has serious adverse event reported in 25% of patients. In the case of Libvio, that is a checkpoint inhibitor, was observed 34% of severe toxicity in patients receiving this drug. In the case of Everferon, the adverse events are only related to the flu-like syndrome that include fever, headache, arthralgia, myalgia, with mild intensity. We will look now to other tumors that we are treating with Everferon. These are the clinical trials with Everpac or Everferon in brain tumors. Our first trial was with the use of Everpac intralesion in patients at the end of the life with really short life expectancy. We prolonged in this patient the survival approximately to 6 months. Then we conducted also treatment with Everpac or Everferon in patients with brain tumor at diagnosis. In this case, we use the intravenous route. This result will be seen later, that is very, very encouraging. Then we continued our development in a clinical trial using Everferon. This was the phase 1, a clinical trial to see for tolerance of the intravenous application of Everferon with excellent results. At this moment, we are preparing a phase 2 randomized controlled open-label multicenter study to evaluate the combination of nimotuzumab, this antibody against EGF receptor, with everferon in patients with grade 4 gliomas. These are the summary of the case treatment with everferon in brain tumors. The results are very interesting because you can see that the percent of patients alive at 6, 12, and 18 months is superior than we have observed or described in the literature. We want to emphasize here that this tumor, grade 4, highly aggressive, after surgery and radiotherapy, when using everferon, we can prolong the survival approximately to 20 months. That is similar to what's obtained with the standard of care after surgery, radiotherapy, and chemotherapy, as you can see in these pictures. These also are results from overall survival according to the stage of brain tumor, stage 3 or stage 4. You can see the blue lines correspond to the everferon. The survival is superior in both cases. And this is a summary of survival of patients with grade 4 brain tumor in the population of the studies carried out. These are the results for intraclinical use. As I told before, we have obtained 6 months of survival. Then, in other trials, we have a better survival when we treated patients at diagnosis. These are around 20 months of survival. And again, I indicate that in the case of Cuban trial, the prolongation of survival is obtained with the use of the temozolomide. This is a chemotherapy. It's excellent result in the other country. But with the use of everferon, we have the same result, very similar to the standard of care that use temozolomide. And these are 2 cases from our doctors, neurosurgeons, that have patients that were operated, then received radiotherapy and chemotherapy, and then everferon. And you can see that they prolong the survival more than 3 years. And this is another case similar that received of temozolomide and everferon, and the survival is more than 2 years. The idea, our hypothesis, is that if you use the combination of everferon with temozolomide after surgery and radiotherapy, we can prolong the survival of this patient more than 3 years. We are also studying kidney tumors after the treatment with everferon. You can see here the survival of stage 3 renal cell carcinoma or stage 4 metastatic tumor after the use of everferon. This is the blue lines, and you can see this is a good survival rate. We have also evaluated some cases of recurrent head and neck squamous cell carcinoma in stage 4 after the first lines with chemotherapy and radiotherapy, and with the treatment also of nimotuzumab. The nimotuzumab is registered in Cuba for the treatment of this kind of tumor. After 3 years, this patient had a recurrence. Then we start to use everferon, and you can see how the lesions were reduced. Then we added the chemotherapy to this patient combined with everferon, and the tumor practically disappeared and the patient is alive. This means prolonged survival. This is also a complicated case, also recurrent, and you can see how the use of everferon can favor the spread of this tumor. Then we will show some results also during the COVID-19 that everferon was used to control the epidemic before the appearance of vaccines. You can see that the amounts, the percent of negativization of patients with everferon is higher than we compare with the everon alpha. Another property that we have found during this trial was the downregulation of inflammatory markers by the combination of the interferon. You can see here, this is download of several markers. We use everferon also in severe and critical patients, combined with some anti-inflammatory drugs. And you can see that in this case, the combination of anti-inflammatory drug and everferon had no deaths. And these are our international scientific activity of our project, everferon. These are some pictures from the first meeting in 2018. More recently, we have also developed a meeting. This was the first Congress to show the result of everferon in our country. In this Congress participated people from more than 30 countries. This was a workshop in Mexico to promote the use of everferon, and this is a neuro-oncology session was introduced in the Symposium of Neurology and Neurosurgery that was held in September 2024. And this is our next Congress in 2025. These are several topics. We are inviting you to participate of this Congress next year.